Hello, everybody. Welcome to our webinar at the Boston Graduate School of Psychoanalysis. I'm Dr. Paula Berman. I'm the Director of Admissions here. I'm also on the faculty. We do have some people already signed up and joining us this morning. We're just going to give it a couple of more minutes before we start. For those of you who are with us, I'll tell you a little bit what to expect. The webinar won't last probably more than 30, 40 minutes. Sometimes people do have questions while we're speaking. Please feel free to type them into the chat box. If you're courageous enough to speak to us, go right ahead. I know sometimes that's awkward in this environment, but if you have a question and you want to communicate it to us, chatting with us is one way to do it. I will be giving a general overview of the school. And then I'll be introducing Dr. Sarah Waso, who will be going through our clinical programs. And then we'll be turning it over to Mr. soon-to-be Dr. John Zitko, who is going to represent our non-clinical programs, our culture programs. But we have some programs that fall in between, and if questions come up about those, we can address those as well that aren't so specific to the ones we're going to be focusing on today. But as I said, I'm just going to give it another minute or so, and then we can begin. Hello, I think it's time for us to start. I'm just going to introduce myself again. I'm Dr. Paula Berman. I'm Director of Admissions at the Boston Graduate School of Psychoanalysis. I'm also on the faculty, and I welcome you all, and thank you for joining us this morning. And I think it's time just to get started with the slides. So as I indicated earlier, for those who heard me, that I'm just going to give a brief overview of the school. And then I'm going to turn it over directly to Dr. Sarah Waso, who's going to be focusing on our clinical programs. And then Mr. John Zitko, who'll be focusing on our non-clinical psychoanalysis and society and culture programs. I also want to let you know that there are some other people in the room here with me, so that you know that the types of questions you ask can be responded to depending upon who you want to address them to, if there's someone specific, because we also have some students in the room with us. We have two advanced candidates in our doctoral programs here with us today. And actually, one of them graduated recently from our master's level program, and one of them graduated not so recently from that program because she's really about to graduate. So, so you can get the student perspective, you can get a faculty perspective, and you can get an administrative perspective as well in terms of your questions. So in terms of the school, we were founded in 1973, so we've been here for a while. We were first founded as a psychoanalytic institute, of which there are many throughout the United States and many throughout the world. However, we then became degree granting. I want to say that happened maybe 15 years ago with our master's degree first and then our doctoral degree. It might have been the other way around, but about 20 years ago, actually. And that's really where our uniqueness is in terms of how we differentiate from other psychoanalytic institutes. We are the only independent psychoanalytic educational school that offers both master's and doctorate degrees in psychoanalysis. I know that's true in the United States. It may be true in the world. So many people come to us because they're interested in having actually not only a certificate in psychoanalysis, but a degree in psychoanalysis, which is unusual. We are a smaller school. Our total student population, I'm going to throw a number out there. It might not be exact, but it's close enough. I want to say about 130, 140. We have a very small campus here in Boston. Campus is one building. It does have multiple floors, but it is one building. We also have a campus in New York City where we have also a graduate program there, and we have a campus in New Jersey as well, which is also a graduate program. Boston is the only campus where we have a doctorate degree offering. So with our school being small, that means the class size is small. So typically in the beginning, the classes are actually a little bit bigger. As you move through the program, they become smaller. But having a class of 15 in the beginning is pretty much very typical. You're not going to see anything much more than that. There are a few exceptions that it might be a little bigger, it might be a little smaller, but that's a good number in the beginning. As you go through, it's going to, as I said, get to be closer to a number like 10. And some of them even smaller. So the student to faculty ratio is very high. There's 2.5 students to every faculty member. Because we offer something unique, a degree in psychoanalysis, we really appeal to a lot of different types of people from a lot of different places. The other way that we're unique is that we do not require, unlike most other psychoanalytic institutes or schools that might be offering degrees similar to ours, we do not require any prior course of study. We like people to come from all different types of backgrounds. We don't require that you've already studied psychoanalysis or psychology or counseling or anything in this area. So we have people coming from all different walks of life, places, perspectives, and backgrounds. So it's a very diverse student body. So just to set the stage a little, as I did before I give it to Dr. Waso, we're going to focus today primarily on our degree programs. And our degree programs fall in two buckets, if you will. We offer clinical degrees and we offer non-clinical degrees. The clinical degrees are training programs that lead to a practice in mental health counseling, which is at the master's level, or clinical psychoanalysis, which is at the doctoral level. And then there are multiple programs within that, but that's the general concept. Our social consciousness degrees are our degrees that fall under the program of Psychoanalysis, Society, and Culture. Those are non-clinical degrees, and what they represent are an interdisciplinary academic way of focusing, on understanding society, culture, and psychoanalysis. So you'll be hearing more about those right now, actually, because I'm going to turn it over to Dr. Waso, who's going to begin by talking to us about the different types of clinical programs and then what ours are all about.
Hello, everyone. Are we in the right? Oh, yes, okay. So let's start by clarifying that we are a psychoanalytic institute, which means that we distinguish ourselves from other academic institutions that provide degrees in psychology, social work, or mental health. Our approach is psychoanalytic in our understanding, as well as in the techniques that you will be learning about as you go through our programs. That is different from an emphasis on learning or social learning, behavior, and cognition as other programs in psychology may emphasize on. So basically, we are interested in understanding the unconscious motivations of behavior and of character development. So the degrees that we offer are master's degrees in mental health counseling and with specializations in addiction counseling or child and adolescent counseling. These are license granting degrees, which means you're going to fulfill all the requirements that the state requires in order to be able to apply for a license. In terms of also the practicum hours, the supervision hours, and the coursework that you're required by the state. So I know we have a lot of international students calling in. Of course, choosing this degree might be relevant or not depending on whether your future plans are to maybe stay in the United States, because licensing is something that is expanding throughout the states, and there is a tendency for clinicians to need a license in order to practice clinical work. In the state of Massachusetts specifically, we're not there yet, but we anticipate that we're moving in that direction. So for people who would like to stay in this country and practice clinical work, it might be in their best interest to complete a master's in mental health counseling, which would then lead to the licensing. For those who are not interested in licensing, they could still do the master's in psychoanalysis, which basically teaches the same theoretical background and will also have the clinical experience and supervision hours, with some differences that would not lead to licensing. A lot of people who go through the master's in psychoanalysis are then interested in moving on to the doctorate in psychoanalysis, which is a more in-depth training about the clinical work, both in supervision as well as in the work with patients. People who move on to the doctorate in psychoanalysis will then have practice in similar to a private practice setting, an outpatient setting, and they will also be required to do some research on a single case study, which will allow them to gain deeper understanding of their work, both in understanding the patients as well as understanding themselves as a clinician. For people who already have a master's degree in a relative field, in a clinical field, they might still be interested in coming to our school to develop more understanding about psychoanalytic theories and psychoanalytic technique in working with patients. And for that purpose, we provide the Certificate in Advanced Graduate Studies, what we call the CAGS, in psychoanalytic therapy or in child and adolescent interventions. One of the important things that I think we provide as a school is our interest is in understanding the clinical work, both from the perspective of the patient as well as the experience of the clinician. And for this reason, one of the things that distinguishes our school from others may be that our students go out into the field very soon after they start the program. They are required to do hours of clinical direct work with patients with a psychodynamic understanding of their patients. And all this practice is going to be closely supervised so that the student has the opportunity to learn about themselves and what gets in their way of understanding their patients and what kind of emotional experiences and arousal they have to deal with in their clinical work. as a clinician. One of the ways that we learn about this is through process learning, what we call process learning, which is that our classes generally have students sitting down in a circle with the instructor as part of the circle, and it is a discussion about, it's an open discussion about the theories that they might have learned through their readings, as well as their clinical experiences or their life experiences that may be relevant to understanding the concepts. So it's very close to the heart and close to home when people are discussing these concepts. It's not only left at a cognitive, intellectual level of discussion. And you will also learn through observing your fellow students how they deal with their emotions and their process of learning. So it's at all levels you're learning both theoretically and at an emotional level in a very personal way. As you see here, a lot of our students, after they completed the master's degree, choose to stay with us and continue to a certificate program or to the doctoral degree, or move on to pursuing higher degrees in the field as well. As I said, a lot of our students, as they're going through the program, for instance, people who do what we call level B, which is the doctoral degree, often end that program with a pretty solid group of patients that are their own private patients. So many people start already a private practice as they're going through the program. But also a lot of our students go out into the community and work in clinics or work in schools. We do have a school program that feeds a lot of clinicians into the public school systems here in Boston, where our students are acquiring a lot of clinical practice. And we also have a group of students who continue to the doctoral program. Okay, I'm going to pass this on to Mr. Zitko. He will talk about the social consciousness programs. Oh, does anybody have any questions? I don't see anything. Before we move on, I don't see anything in our chat box. Does anybody would have any questions about what I've described? I don't see any. Okay, thanks.
All right, hello, my name's John Zicko. So I'm going to just go through a little bit of the MA and the doctoral programs in this Psychoanalysis, Society, and Culture program. So I think in many ways the master's and the doctorate are similar, but there are some slight differences. The MA does terminate with producing a thesis, as the doctorate terminates with a dissertation. And the only other major aspect of the difference is the doctoral degree is that you have to take more classes in theory, methodology, and then kind of zone in on an expertise in a field. Anything that's kind of interdisciplinary within psychoanalysis, culture, and society. There's kind of two main routes in which one can kind of appreciate and approach this interdisciplinary aspect. One is to take on psychoanalysis as a culture, as a history, and to see the methodologies, the clinical practices, the techniques, and to kind of analyze them theoretically and empirically to see kind of how they kind of shape the analytic scene. The other way is to kind of use the theories and methodologies that you might find in cultural studies, anthropology and the like, or linguistics, and also supplement that with sociological methodologies and theories. So you kind of come to an object, an intersectional object in which you can study immigration, race or racism, the literature, the cross-cultural issues of psychopathology, social policy, violence, gender, and sexuality are just some of the aspects in which people go ahead and perform this kind of intersectional, interdisciplinary method and theory. So our training is kind of dual in the sense that we are not trained as clinicians, but we do take clinical classes, and we also take a lump sum of cultural classes and social theory classes. Now, with the cultural and social theory classes, I think a real great positive that the school has to offer is that most of the instructors, the faculty, the professors are coming from many different institutions. Quick example is that one could be studying cultural anthropology from professors at Boston College, and then one could be studying social theory from a professor from Yale. One could be studying literature and race and colonialism from a professor at BC, Boston College. So there's all these kind of intricate ways in which you can kind of link up with your interest and get supported by other faculty members and departments that are kind of on the forefront of their field. And I think most of the students probably, when they graduate from either the master's or the doctoral program, they either go and use this kind of knowledge to supplement their clinical practices with dealing with like race or immigration or something along these lines, or gender and sexuality. They go for academic research or academic teaching post, and probably lastly something in the social services and nonprofit arena. So that's a very kind of quick introduction. Does anyone have any questions regarding anything that I said or anything I did not say?
Okay, so hopefully at this point you have a little bit of a better understanding of the clinical degrees we offer and the non-clinical degrees we offer, and what the school might look like a little bit, and how we practice here as an academic institution, and a little bit about what our student population is like. Right now I'd like to just focus a little bit on who our faculty is, because obviously there's going to be a lot of interaction with them. I would say 90, if not higher percent of our faculty are practicing psychoanalysts. So in the classroom, you're going to have people with a real-world experience practicing psychoanalysis and working with the theories and techniques that you're going to be hearing about. And as Dr. Waso mentioned, the class itself is sort of a microcosm of a psychoanalytic session or group, and its psychoanalytic techniques are actually used in the classroom to help enhance learning. So that's definitely, a major focus of the faculty here. But also we have clinicians, faculty who work as clinicians and administrators, not just in their own private practice, but also in mental health agencies and in clinics. So they have a very practical understanding of how to integrate what's learned here in the school into other private or nonprofit clinical settings. Some of our faculty are involved in social justice. I would say some of those faculty teach in the clinical program, but they also have a very strong presence in the Psychoanalysis Society and Culture program. Some of our faculty are running school-based programs and substance abuse programs. Once again, so you can see we're very much in the real world out in the community. Some people think when they think of psychoanalysis that it's just on the couch, one person with one analyst, and that's the end of the story. But we're really a firm believer in applied psychoanalysis and bringing the theories and techniques of psychoanalysis into the broadest spectrum of the world. Our faculty also are scholars. They've been published. They speak in various places at various conferences. So it's very much a rich dynamic that the faculty brings into the classroom. Faculty work when they are working either in their own private practice or in clinics or in schools, are working with a very diverse population. They have experience with adults, with children, adolescents. There's a lot of experience here in addictions. There's a lot of experience here working with psychotic patients, with teachers in the classroom, with police departments, and on and on. What does this mean for you? It means that when you graduate, you'll have been exposed to how to apply what we learn here to a very broad range of people. You'll have a broad range of experience in your field work placements and in your internships, and you'll be able to really, I think, present yourselves as people who can work with a broad range of problems or in a broad range of programs, and you'll be able to customize it based on your needs. This is, I would say, rather unique to our school. Oh, there's a question. If one is a student, are there ways to get a fellowship with a professor? So I'm going to guess that that has to do more with financing, potentially. There's certainly opportunities to do research with professors. They're not necessarily fellowships, but if there are any questions about the financing end of it, I'm going to refer you to Stephanie Woolbert, who can talk to you about what the financial aid options are here. And if there's any specific question about research with a professor or a particular area of interest, then you can either let me know now or you can contact me later and we can explore that. Oh, so there's another question, but I can't read the whole thing. The question is, hi, if my psychology background was psychology of organizational and industrial, but I'm so interested to join this program, I think I can't read the whole question, but I think the idea is if there is a background in an area of psychology that really does not map to what our focus is this program still accessible to you? Absolutely. It does not. We really welcome that you have that background. And there's a potential, if it was, depending upon what level it was done at, if it was done at the master's level, that we can potentially even transfer some of those courses, but they're not requirements. We have absolutely no prerequisites other than if you're entering the master's program, you have to have a bachelor's degree, and if you're entering the doctoral program, you have to have a master's degree. But in terms of what those disciplines were in, we're open. We like the eclectic background. Seems like yours might be a little bit more focused on psychology. We think that's wonderful, but not a requirement. So, for those of you who are interested in applying, let me go through a little bit about what those requirements are. We, first of all, do not have a minimum GRE score. And in fact, we don't require the GRE. If you took it, great. But we really aren't that concerned with the GREs, nor are we specifically concerned with your GPA, your average grade that you had in college. Our admissions are done on a case-by-case basis. So every time somebody submits an application, we look at the whole picture of that candidate. And we're very much interested that, yes, we want to know you can perform successfully at graduate level work And we, as I said, we don't look at the GRE or the GPA, but we'll look at just, where'd you go to school? Did you graduate? We ask you for a writing sample so we get a little bit of feeling for your writing skills. We ask you for a statement of interest so we understand why you might want to join us. And that gives us a real flavor for, who you are and if this might be a good fit. We also require an application form, the application fee, 3 letters of references, hopefully 1 academic and the others from professional sources, but this varies too, and there's some flexibility in that. Of course, we require your undergraduate transcripts and your reference waivers. However, this is the first step, but it's not the most important step. These are all paper things, right? So we're going to take a look at all that you've submitted in the mail and what your references have submitted, and we'll get a feeling for whether or not we think this might be a good fit for you. However, if we do think that it looks like, yes, we think that you make baseline criteria with us, meet them, then we're going to move you on to the next stage, which we feel is the most critical stage. And that is the admissions interviews. And this is once again where we differ from some other schools as well, because this is the crux of our application process. Each candidate will be meeting with 3 individual faculty members, and it's an opportunity for us to understand a little bit more about who you are, what your interest is in coming here, and answer any questions that you might have, and for you to ask us your questions and to get a feeling yourself of whether or not this might be a good fit for you. It's really this piece that gives us an understanding of whether we think there's a good match from a personality standpoint, not just from an academic standpoint. So that's pretty much the application process. We do it on a rolling basis. We do have a priority deadline of May 1st, 2015 for our next academic semester, which starts in September 2016. Yeah, they should say 2016. Yeah. So yeah, it's May 1st, 2016 for fall 2016 admissions. And we as your materials come in, we process them as they come in. The May 1st deadline pretty much will get, if you meet that deadline, it'll almost guarantee that there'll be enough time to process your materials and have your 3 interviews done in a reasonable fashion before decisions need to be made. That's particularly good or an important deadline to meet for international candidates who also have other things that need to be considered, like student visas. If your application materials are in everything but 2 things or something and it's May 15th, we'll work with you. Keep talking to us. We try and if there's openings still, we try and make things work. But it's all done on a rolling basis, even though the priority deadline's May 1st, 2016. So I know this slide says questions on the top. I know you feel free to ask them here, which I did just get another one. This one says, hi, I already have a master's degree in psychology. Can I enroll in the PsyD program right away? Should I not pass a master's degree in psychoanalysis? So this is what I think I want to say to you without knowing more. If you already have a master's in psychology, you can apply directly into the doctoral program, and you can immediately start that program. And what we'll do is take a look at your master's transcript, and we'll transfer as many classes as we think we can that makes sense given what our requirements are, so that you might end up starting in the program in what I might call an advanced standing. So you might be able to eliminate, let me just say, a semester or whatever in the doctoral program because your prior training may really overlap enough with what we require so that you don't have to repeat things you shouldn't have to repeat. So hopefully that answered the question. You don't have to, I'm just kind of annotating on to my answer based upon the rest of the question. You don't have to have a master's degree in psychoanalysis to go into our doctoral program. Your prior psychology degree should work just fine. So if anybody wants to learn more, our website probably at this point is www.bgsp.edu. Please feel free to email me directly. Many of you already have been doing that, and I've really enjoyed the conversations, if you will, that we've had via email. Would love to talk to you in person also, if that ever makes sense, to call me, or if you're local, come on by. We have an info session going tonight at 5:30. I will say that this webinar and the information open house that we're having tonight at the school is the last one before the May 15th, whatever it is, May 1st application deadline. So for September admissions, this will be the last public forum, if you will, either webinar or open house. If between now and then you will have other questions, you want to come here to the school individually, just let us know, and we really love to have visitors. And also, if you're not local, we're always happy to talk on the phone or Skype. Members of the admission team are available for that. Often some of our prospective students are interested in talking with other current students. As I mentioned, we have 2 of them in our room here today, and graduates. This often happens if their prospective students are applying from a different country. They want to know culturally what the transition process might feel like and be like. Just let us know, because our students are always, many of our students are always happy to talk and answer questions in that regard. So other than telling you that if you're in town or at an open house, or you want to come to a continuing ed event or whatever, just always feel free to stop by and visit, or just contact us via mail or phone, because we like hearing from you. So that's the end of this kind of formal presentation. I can just ask you one more time if there are any other questions. If not, we look forward to hearing you and from you, and maybe seeing you and meeting you at some point. Okay, very good. Thank you so much for joining us this morning, and I hopefully will be seeing more of you. All right. So the first question here is, how many applicants do you get and how many are accepted? That's a good question. We get it a lot. Every semester, I think it varies. All I guess I want to say is I think that question comes from a wondering of, am I going to get accepted? And I will have to say that if there is a real connection to the school and a real interest in what we have going on here, and it seems that this is something that would match what your interests are, there's a likelihood that you'll be accepted. I don't want to say that we don't not accept people. We don't accept some people, but it turns out it usually is the right decision for them and for us. And we get a chance to talk to our applicants about that. So if you're thinking that you want to get accepted and you're hoping you might have a good shot at getting accepted, I'd say go ahead and continue along thinking that way. I think through the process gives you a way of feeling whether or not it's right for you, and us giving us a way to see whether it's right for you, and usually the right decisions are made. Okay, the next question is, the one I just did, how many applicants do you get? The number really does vary semester to semester and program to program. Does BGSB offer online courses? At this time, we do not. And it's not just a technology limitation, because I think we can overcome those. It's really hard to think about how online learning would integrate into our community and our culture, because we are all about being present and being with people in a real and meaningful way. And although there are some ways to try and bridge the gaps between what goes on here in a classroom and what might be happening in an online experience, there's still a big gap between those two. So we are continuing to explore it. We are looking at one program in specifically, which is a very advanced program for people who are already psychoanalysts who just want to get their, not just, but who are interested in getting their doctorate. They're very advanced. They've already been through psychoanalytic training. We're looking at an online program for them. But for our students who are just beginning to think about psychoanalysis and what it is we do here, being with us, we think, is the best way. Okay, another question just came in. Okay. So there are two more. How much of the program is counseling? So that's a really good question, because if there are students who are looking at a master's in mental health counseling program, which there are many, both in Massachusetts as well as throughout the United States, there's going to be a counseling component here as there is in those classes. We are mandated by the state of Massachusetts to provide a certain quality and quantity of academic studies and clinical fieldwork placements in order for our program to qualify for the LMHC, the License in Mental Health Counseling in Massachusetts. So we adhere, as do all the other, I'll stick with Massachusetts, all the other schools in Massachusetts have to adhere to the same disciplinary areas, academic areas, and fieldwork requirements and internship requirements mandated by the state. You will get all that here. You will get all that counseling information and experience here. How we differ is that there's going to be like a sidebar to all of that, and that's going to be your psychoanalytic exposure to theories and techniques. It's going to be infused into your other classes. You're going to get what everyone else gets, but you're also going to understand how we might approach some of those areas. And you're also going to get an additional amount of academic work and field work that's more focused on our discipline of psychoanalysis. So you're really almost getting two programs in one. I'd say 1.5 programs in one. You're going to get the full counseling program, and then you're going to get psychoanalytic orientation in that. You will not, I say it's not 2 in 1, because when you come out of that, you're not a psychoanalyst. You'll just be psychoanalytically informed, and you will have had a fieldwork placement that'll reinforce those theories, but you're also going to have an internship that is required by the state. So you're going to have both, which is more fieldwork experience and hands-on experience than you'll probably get in any other school as a result. So the other question is, do you have assistantships? We do not have assistantships. We do have some work-study programs or opportunities. Those are available to second-year students on a limited basis. So coming in out of the get-go, you need to think about how to finance the program independently. Of course, if you're local, U.S., stateside, you can qualify probably for the government student loans. That's something, once again, Stephanie Wilbur can help you with. But in terms of our own scholarships and assistantships, what we do provide are limited numbers of work-study positions. unfortunately. Okay. Well, once again, thank you for joining us. Thank you for the questions. And if there are more, hopefully you know how to get to us to hopefully help us answer them. Oh, just had another one. I have a bachelor's degree in psychology and a master's in neuroscience. I was wondering if there's a possibility that I enroll in the doctoral program. Absolutely. Yes, enroll. We'd love to see your application. Sounds like you'd be a very good candidate. Approximately how many students create their own practice from the master's and the doctorate program? If you are in the clinical side of the programs, I'm sure this is what you're interested in, someone in the room can call me wrong, but I'm going to say 100% of the graduates have a practice once they either graduate the master's or the doctorate program. Does anyone here know of anyone who doesn't have a practice after graduating?
From the doctorate program.
Or the master's?
Not necessarily.
What do you mean?
After they graduate.
That's what we're saying.
Yeah, after they graduate.
Yeah.
Masters, yes.
Yes. We think 100% after you graduate. Now, one thing I want to say about the master's program. Once again, this is state requirements. You can come through our master's program. You're going to get a master's degree. You're going to have satisfied all the requirements, the academic and clinical requirements required by the state. But the state then wants you to do more. The state wants you to pass a test, and then the state wants you to have about 2 years. It's 2,600 hours working in the field before you get your license. So many of our graduates do that. And they're working and they're getting paid, but they're trying to get their license. Once you get your license, then it's very easy, or certainly much easier, to start a private practice, because then you can do third-party insurance billing. So, it's not you graduate and you're done, unfortunately, if you want your license at the master's level and you want to practice.
That's true about any school they go to.
And that's true about any school you go to. In Massachusetts, and quite frankly throughout the country, they all have their own step-by-step hoops that need to be jumped through. The only thing a school can do like us is make sure we give you all the academic and clinical master's requirements met here, and we do that. We do as much as we possibly can do. With that said, I'll tell you our students all have passed the test, and our students have all gotten their license. If they want their license, they've gotten their license. Someone else is typing a question. But I don't see it. Excuse me. I am a psychologist and a graduate of a master in clinical psychology. What kind of program would you recommend for me? I would think that you might want to consider a doctorate degree in psychoanalysis. Or if you don't want to think about right now going for the full doctorate, we have the program that Dr. Waso mentioned, the Certificate of Advanced Graduate Studies. That is a recognized certificate, once again, by the state of Massachusetts. We're accredited to give it. It is a degree. And you could then take that. It's about 1.5 years, 2 years. You would come out with a Certificate of Advanced Graduate Studies. We have 2 of them, one in psychoanalytic psychotherapy. So if you really want to enhance your understanding of psychoanalysis, that's the one to go into. We also have a Certificate of Advanced Graduate Studies in Child and Adolescence. So if you want to focus on that, you can do that. That program's actually a little shorter. The good news with both of those programs is that those credits of those degrees apply towards the doctorate. So if you then decide, well, I got my CAGs, these were doctoral level classes because they are, I want to then apply to the doctoral program, they transfer in. But if you want to bite it off in a shorter chunk and think, oh, I just want a year and a half, 2 years to understand more about psychoanalysis and psychodynamic psychotherapy, I would suggest you take a look at the CAGs program. Okay, another question is coming in. I love this group.
I'm Huang. I'm not Amy Huang.
Are scholarships and work-study positions available for foreign students? I think what I want to say is pretty much the same financial opportunities are available whether you're a foreign student or whether you're a domestic stateside student. We have no scholarships for either one of those categories, and we have work-study positions limited for both of those categories. So if you're a foreign student, yes, you can apply for one of our work-study positions. If you're a foreign student, we don't have scholarships. But as I said, that's true for everybody. I am a homeopath and I'm doing my master's in psychotherapy and counseling in India. What kind of program would you recommend me? Well, I think once again, if you get your master's, I'm assuming you're planning on finishing, I would recommend either the CAGS program, the Certificate of Advanced Graduate Studies, or that you can apply if you are interested directly into the doctoral program. And once again, we would take a look at what you've already studied and see what we might be able to transfer in, taking a look, of course, at international equivalencies. How do you determine who receives work-study assistantships? I think that is a good question. I'm not sure I have an answer for it. It really depends upon what we have available that semester, who is applying for it. I think in general we might give a legs up, if you will, for the student who maybe is in their third year as opposed to their second year. And I'm not sure whether it's based on need or not. But that's once again something you might want to address to the financial administrator, Stephanie Woolbert. I'm an international candidate. I've been graduating in the Masters of Counseling Psychology in America. I want to pursue a PhD. What area would you like to recommend to me and how? How much possibility to me to be accepted? What if I'm interested in clinical psychology? All right, let me start out by saying we do not offer degrees in clinical psychology. If you're interested in cognitive behavioral therapy and research and science, learning, you want to look at those schools, and there are many of them, that offer a PhD in clinical psychology. Or sometimes it's called a PsyD, P-S-Y-D. We don't have that here. That isn't who we are about. We offer at the doctorate level a PsyD, P-S-Y-A-D, and that is a doctorate in psychoanalysis. People who are interested in learning at a very deep level how to work with people, what makes people tick, how does the unconscious influence their lives, learning more about their character, learning more about how to work professionally, one-on-one, in a clinical relationship, and study things like transference and resistance, you're going to come here. If you want to understand how to work with people on a behavioral, get them to stop doing what they're doing in a short-term kind of way, you're going to want to go to a different program. So it's really going to be driven by what you're interested in. We work very deeply with people to try and understand what makes them tick. If you want to apply to this program because you're interested in getting a PsyD and you're interested in psychoanalysis, then apply to that program. Your background, having a master's in psychology, qualifies you to apply directly in. All right, I'm going to have to say this is our last question, and I thank you so much for your questions because you've given us some great ones, and we don't always get this many. But we're going to have to call, I'll have to make this the last because we do have to stop. It says, thank you for your answer. The doctoral degree sounds good for me. I am from Indonesia. Is it possible to use my Indonesian license of psychologist and master's in clinical psychology for the doctoral program? I've been using psychoanalysis approach in many of my therapeutic interventions lately. I guess I want to say the same thing would apply to you. We'll take a look at your transcripts. We'll see if we can apply some of your prior training into our course of training. In terms of the license itself, we don't look at licenses. We certainly don't look at licenses of psychology because we're not a school of psychology. So I can't tell you you can use your license to practice here. That's something you'd have to investigate.
It's probably a state level.
At a state level, exactly right. But in terms of the academic question you're asking, we would love to see your transcripts, and we would be interested in looking at them to see how much of what you have studied prior and have learned prior can be applied to this program so we can transfer in those credits so you don't have to repeat anything. Okay, so thank you once again. Great questions, and good day.